Hello, my name is Masoma, and this is my research pitch on NTMs in an aging society. Have you ever heard that riddle, what goes up but never comes down? Well, it's your age. We live in a world that's getting older. By 2030, 1 in 5 Americans will be over 65. That's good news for longevity, but not all that extra time is healthy time. With age comes higher vulnerability to diseases we barely understand. One of those is non-tuberculosis mycobacterium, or NTMs. NTMs are environmental bacteria that cause chronic lung infections and, in some cases, skin and soft tissue infections after procedures like cosmetic surgeries. Rates are rising, especially in older adults, where cases can be as high as 47 per 100,000. But despite this, we don't really know the full epidemiology of NTMs, like who's getting infected, where, and under what conditions. Current treatments are long, toxic, and often fail. Without better data, improving them is almost impossible. Here at UCI, there's a large collection of frozen NTM samples with handwritten records attached. The problem? The data has never been organized or studied, and is about to be discarded. Years of potential information could disappear, along with the chance to understand more about this disease and the people it impacts. This is where my research team's project steps in. We plan to rescue those samples before they're discarded. Using AI, we'll digitalize every handwritten note, organize the information into a structured database, and finally study the data. Why does this matter? Because once the information is organized, we can identify who is getting NTMs, where, and under what conditions, and maybe even draw some groundbreaking connections from it. The kind of insights that could feed new research, inform doctors, and even guide the development of treatments that aren't as toxic and burdensome for some patients. Here's how we'll do it. We're finalizing the IBR approval to access the samples, while testing AI tools to digitalize even messy handwriting. Once organized, we'll analyze demographics, trends, and treatment gaps. With my PI's infectious diseases expertise and modern tech, our small team can breathe life into this data. This isn't about samples and spreadsheets. I've seen what happens when communities don't have answers and illnesses linger without research. Unlocking this data could reshape how we understand NTMs in an aging society. My background and drive to go into medicine pushed me to find gaps like this because every unanswered question is a missed opportunity. By rescuing and studying these records, we're opening doors to discoveries we haven't yet imagined. That leads me to my overarching research question, which is quite simple. How have the patient demographics, disease population, and treatment outcomes of NTM infections changed over time in the archived UCI dataset? By answering this, the hope is to not only preserve a valuable resource, but also give future researchers the insights needed to improve care for an aging, vulnerable population. And because we're still in the early days of this research, this question may evolve as the data reveals new patterns and possibilities. So, this is a little bit about my research on NTMs, and I hope you enjoyed my pitch.